I had asked you earlier who would be reading the story, and Richard volunteered, and so we're just going to go with you, and you're going to have the experience of being on air live. You know how this works by now. You've had plenty of training.
Yes, I do.
Let's see if you've put it into action. Camera 2 is yours. Introduce yourself. The story is on the auto cue. You have a backup one right there in front of you. If you feel like ad-libbing, adding things, knock yourself out. Okay. Shall we do this? When you're ready. All right, now my name is Richard Onyango, aka Richie Roger, contestant on The Presenter Season 2, hopefully winning tomorrow. Now, a man in Nyeri County is slowly turning white after what he says was a dose of supposed skin disease medicine. He was prescribed the drugs at a private clinic, but since then he has had to sell everything rather he owns to reverse what he believes were the side effects of the drugs. KTN Central Kenya reporter Carol Nderi has that story. Let's take a look at this bizarre story, because I'm interested to see what happened.
55-year-old Peter Ndongo winces in pain with every body movement he makes. The misery is etched on his face as he shares his tribulations with us. His skin is covered in pale blotches which sometimes crack open, leaving him in abject anguish. He cannot stay in the sun for too long and is forced to stay indoors at his shanty in Majengo slums in Nyeri. Just 8 months ago, this father of 6 led a normal life as a guide at a local butchery, a job that he has since lost. What started with a trip to a small private clinic in Nyeri town, he says, was the beginning of his current woes.
Sasa kapeo dawa ilikuwa saa malaria na typhoid. Sasa hizo dawa wakati nilikunywa, kakunywa siku ya kwanza, ya pili ndio iliniumiza. Sasa gasikia mwili imepiduka, gaguka. Sasa na gasikia yani mwisho mahali nilikuwa nafanya kazi na gapeleka na kaenda hospitali. Kwenda hospitali General Hospital Nyeri, ndio dimabia tabu yangu.
Ndongo claims that no sooner did he start taking the prescribed medicine than his problems commenced.
Sasa ndio dilisia hata kutoka gozi, kutoka damu kwa mwili. Huko kunatoka gozi, yani ni damu tu. Yani hata kulala ni shida, kukula ni shida. Hata ukaa chini ni shida, kusimama ni shida, kwa jua ni shida.
When he sought alternative treatment at other health facilities, the doctors asked for a sample of the medicine he had taken, but upon returning to the former clinic where he had been treated, he found it closed, no longer operational. He says he has had to sell his property to settle the hospital bills and has nothing to his name. He claims that his wife left about 3 months ago.
Sasa Kenyatta kuenda, ndio dilipata kapata kitada. Kupata kitada, huko galazo mwezi mzima. Sasa katengenezo, kakuwa kama nakuja vizuri kidogo. Kakuja kama nasikia nafuga peo luza, kakuja. Ukuja nyuma ya wiki mbili. Ila ugonjwa tena ikazidi.
Dr. Irongo Mwangi, a practicing dermatologist in Nyeri, says photosensitive dermatitis is a condition that can be triggered by drugs, but has other causes such as exposure to the sun for those predisposed to the condition or even chemicals in the environment.
There are some which are triggered by drugs, others are triggered by chemicals in the environment, others are things that you apply on yourself, including cosmetics.
There are various forms of photosensitive dermatitis.
Mild forms, medium forms, and very, very severe forms, where life is almost impossible on exposure to sunlight.
Peter now relies on his neighbors, friends and well-wishers who pass by his shanty and offer him food when it is available.
Hatuna related na yeye, lakini wakati tuliona vile kulingana na ugonjwa yake tukaona tunaweza saidiana, lakini sisi tumefika mwisho.
Tunapata kwenye runinga mambo mengi yanafanyika, madaktari ambao wanafanya. Tunataka kujua madaktari hawa ni madaktari ambao wanafaulu ama ni madaktari basi wanakwenda kununua makaratasi na kuja kutibu watu.
Ng'ombe nilikuwa naye yote nimeuza. Buzi nilikuwa naye yote nimeuza. Na sikusaidika. Sasa kaisha kila kitu. Sasa sina kitu yoyote.
He is a pale shadow of his former self but remains optimistic that a cure is round the bend. Carol Nderi, KTN, Nyeri County.
That very, I'm not even sure what to
That is
label
a
it,
very
story.
interesting story,
Yeah,
yes.
from Nyeri. But how do you think you did in terms of
Well,
your presentation?
I did good.
Let's ask what your